just that. Dr. Misamichaka just sent me a message and she said we can start. She's finishing up with one patient. You see at the hospital. So as Dr. Fabian, they will join us as soon as they can. You know, Dr. Gwen did ask because she's also traveling. Miss Jessica did. Miss Crowd, that's the teacher from Tanzania. That's in fact, you really need her to be here. She said she's gonna try because right now in Tanzania it's 5 in the morning.
Oh gosh.
So she said she's gonna try if she wakes up. So I text her and see hopefully she will come in. But she will give us, I mean, whatever we're discussing right now, especially for school, then she will give us like in a real life, because is it gonna work or not? But if not, then we can brief her later on. But at least we'll be able to talk about it. Miss Victoria is gonna join us a little bit later because she has an appointment which is running over to 5 and then she's gonna show up. And I think that, okay. So, welcome to the discussion, medical mission, schedule, activity, and logistics. So the reason we have this meeting is because we have multi-sites medical mission, which is always a challenging. Because usually if we're going on one area, then we just focus on all of us to be in one site. But we're gonna be almost in 4 places, which is like for whole 2 weeks, and then Magnet to the sports center is probably going to be 2 or 3 days. We're not going to be that long because the kids are usually in school during the day, and then we have to find out that Thursday or Friday we'll be able to go and see them when they're doing their practice. But that one is going to come up later. Whatever we discuss for school, also half of it is going to apply to them. That's why in a conversation today, you're not going to hear me say anything about Magnet, but Magnet is going to be included on the things that we're going to do for school. So the school is the one which is the most providing challenges than everything else, because we do have 800 kids. And then with those 800 kids, there's multiple activities that we're going to do, starting with, oh, let me share my screen, that'll be easier for you guys. So right now you should see my screen, right?
Yes, we do.
Yeah, so yes. So all the, I mean, I have all the tabs for everywhere we are going. So let's start with the school. So the school has the most activity because it included almost every avenue of things that we're going to do. So one area for school is, you know, the normal training that we usually do, the hand washing, dental hygiene, you know, toothbrush, toothpaste, and teaching these children. And then I didn't put the teacher, but I'm going to add that, you know, like a staff development for the teachers. That is going to come up with nutrition part, which I didn't put that in anyway. So for sorry about this, I should be. Okay, so for the school, as I said, hand washing technique, dental hygiene, that's usually all the medical mission we have done that, encouraging the children to learn that part. So that is going to continue. The second part, which is something new we're going to introduce for this quarter, I mean this medical mission, sorry, is the science inspiring. So we're going to try to find some activities for, especially for 5th, 6th, and 7th grade, to be able to educate the kids and inspire them for science subjects or science areas. Nutrition is the big thing. So part of it is going to be to try and get the money to provide first breakfast for the kids. And then the second part is to teaching the kids, you know, the diet, my plates, all these things that we discuss, we teach our children here. We're going to do the same thing in Tanzania, using the food that is available for them. So Ms. Teresa, I know she didn't respond, but I'm not sure we can share the video, the audio after this. But so she's working on different specific diet that the children should have, which is available for them, and then teach it with the teachers, and then they can continue teaching when we leave from there. And then, of course, something else for physical activities, we have Mr. Bradford, who's going to probably provide some martial arts, which is going to be included in the PE. So we have to fit in the schedule for where they can do throughout the day, because the children already have that period right now. So that's why I wanted Ms. Cora to be to the meeting, so to be able to tell us how much time do we need to provide it for Mr. Bradford to be able to provide those martial arts training or the physical exercise for those kids. And then for sports, usually the sports that they do after school, we have to figure out from Ms. Clara, how many days a week, and I believe it was 3 days a week, but we're going to find out if we need to get those kids for those 2 weeks that we are there, then we see them more. And wherever who's going to be working with the children with the exercise part, we want to make sure they are viable for the kids. And then, of course, the big part now we added for school is the vision screening, acute screening, eye exams. So that's the part which Dr. Vanessa, thank you for being here. So we're going to do that. So we have identified the children who are at risk right now. And then so she's going to start with those and then go back and see as many kids as she can while the time is there. So more likely all this activity will be done at least 8 days. And then usually we leave 2 days because if we need to evaluate something or something happens or you go in and, I don't know. So at least we plan for 8 days, although the actual days for medical mission will be 10. And then so with that vision screening, then yes, we're gonna need a specific team that is gonna be working with Dr. Vanessa. We have already 2 people from Tanzania, Dr. Mhina and Dr. Redempta, who are gonna be working with her. And then also on this side, we're getting nurses to join her. So then there'll be, I think one of them, Ms. Tamasha, also she's from Tanzania. So she's gonna join the team for Dr. Vanessa there to help with the visual screening and then help with other stuff. So as I said, that group probably is gonna have maybe 6 or 7 people working together in that group. And then of course, physical examination. So now that's why Dr. Msambichak and Dr. Fabian, the pediatricians are gonna be needed. There's 800 kids and also we have 3 hospitals. So when we say we need to figure out the logistic, that's the challenge it comes in because if, for example, for Dr. Msambichak and Dr. Fabian are needed at the hospital to do other stuff. I'm gonna show you other screening for those 3 hospitals. So we have to figure out how many days they need to be in school, how many days they need to be in Muhimbili, how many days they need to be in Buguruni, how many days they need to be in, which I also didn't mention. Oh, Mwananyamala, I'm sorry, Mwananyamala. So, and that's why, as I said, the schedule is gonna be a little bit challenging, but I know we can do it. So for me right now to think quickly, I always think probably Dr. Msambichak and Dr. Fabian, unless we get more pediatricians, they are more likely to be in those areas only 2 times, like 2 days here, 2 days there. So to make sure that means we need more people to work with them. So, you know, like for example, nurses and the people who, not necessarily the healthcare people, to be able to register, put the people in groups and then, so then Dr. Msambichak and Dr. Fabian will be just seeing patients and going. The same thing that will be happening for Dr. Vanessa, to be seeing the children. So the documentation and getting the statistic, that is not going to be for the doctors to do, it will be everybody else to help so we can speed up because we have a lot of kids. And I'm hoping that we get more physicians in Tanzania or even here in the United States who can work with Dr. Vanessa. So we can speed up, to see as many kids that we can. The same thing for physical examination. So that's just an example. So I'm gonna show the other screen also, and then we can come back and discuss logistically how do you guys think it's gonna work. So that is for school. So let's go for Buguruni, for example. So the Buguruni, also the training is gonna be under the postpartum hemorrhage, obstetric emergencies, which of those things goes together. So if somebody is scheduled to go and teach those things, you spend the whole day there. So maybe morning you'll be doing postpartum hemorrhage, maybe afternoon you do emergencies. So we can allow people to do like the full day of certain things on the same area. So are they gonna do 2 or 3 days in one area, or are they gonna do 2 days here and then go to another day or to another location like that? So that's what we have to discuss. So hypoglycemic, that almost can be lumped in people who are working with the neonatal resuscitation, like Dr. Msambichaka and Dr. Fabian. I'm missing Nori, the nurse practitioner who works with neonates. So like the hypoglycemic protocols help baby breathe, because usually we teach neonatal resuscitation here in the United States, but in Tanzania, they're not there yet. Equipment-wise, which are needed for those training, then for the Tanzania side, we have to teach help baby breathe, means you use that training for limited resources areas. And then so newborn assessment, which as I said, Dr. Msambichaka and all the pediatric teams, we're gonna work on those areas to try and teach. Of course, on those hospitals also, Dr. Gwen Randall is gonna be doing the anesthesia training. So thank God Dr. Gwen is going to be doing that, but also she needs to be on all those 4 areas, including Ban. So then we have to schedule also for her to be at least 2 places, 2 days for each place to be able to go and teach. And that's why we have to do a lot of training before we get there, because 2 days in Muhimbili or 2 days in Mwananyamala, that's not enough for training this, what we are trying to do. Unless we have 5 anesthesiologists or anesthetists to go with us, so then we can put 2 in each hospital, and then there will be a full 10 days of anesthesia for every hospital. So that's why the recruitment part comes into play. So for all those acute areas, those are the training. It's going to make sense when you do the schedule, like color-coded schedule, to be able to know what exactly it is. Ban has something different. So Ban doesn't have all this stuff on the neonate and stuff, but they still have the same thing. If you've been looking at this screen, you can see nutrition education is everywhere. So Miss Teresa, we have to share her in all these 6 areas. Means all the 4 areas for the hospital: Ban, Mwananyamala, Muhimbili, Buguruni Health Center, and the school. So all those areas, we have to share her. And so for training purposes, we have to figure out which area needs the most. And then once we get that schedule, then she'll be probably in each hospitals, in each location 2 times. So the same thing we're going to share with her. And then so for Miss Victoria, she's going to have with Dr. Mrema, who is going to be the host for those areas. And then so she probably more likely be in one area for 5 or 6 days. It depends on what the schedules are. And then, or if she's needed somewhere else to go and help. If we have maybe at school, we have a child who is experiencing burn and we want at least for her to come and give ideas, then maybe the next day, if she didn't have any specific state for Muhimbili or burn units, then she can go to another areas to go and help us with that. So that is just an idea of putting each area by itself, so be able to create a schedule, but also in planning purposes, it has to be all to the master list in one area to be able to explain that, who is doing what and where. Does anybody have any question? Going once, going twice. So for Buguni, for example, Buguni, Miss Dina Komakoma is going to help us there, and Mwananyamala, that's Dr. Benella is going to help us. So all these things we're doing in the schedule, we have to also give it to them to make sure that they schedule those activities around. So let's say, for example, if the training needs to be done during the rounds, like means like 7 in the morning, we have to be there before 7 to be able to start the training, or because that's usually the most time people meet. So if we start the area, then we have to get there as soon as before that time, getting ourselves ready and then start teaching. And as I said, majority of the people, once they are assigned in the specific area, they might not move as much unless you're the lead on that area and you need to be somewhere else, then you can move. But before we go, probably by the end of April, we know who is going where and adding more people on that team. And then so by the time we get to the medical mission, every single person we know which day, what time, what are they going to be there. I mean, of course, we have to be flexible because you might get there, maybe there's an emergency. So if there's an emergency, guess what? We have to wait because the education is not an acute thing, especially if we're working in the hospital. Or maybe you get to school and maybe there's rain. And you know this, unfortunately, this area for the school, the drainage is not the greatest. So if there's too much rain, we might not be able to teach that day. So we have to be flexible. And that's why I said, we're supposed to be there for 10 days. However, we are planning for 8 days. And then just in case, if there's any challenges that arise, then we can rearrange ourselves and be able to accommodate what needs to be done. So we have to give ourselves time like that. Any questions? I can come out from my screen so everybody will see everybody else. Okay, any questions?
Yeah, I have a question.
Yes.
Wanted to find out if that thing on. Okay. Would there be things done before we get there? Okay, so we would have their acuities and know how many kids will need the services.
Oh no, I think the acuity we wanted to do ourselves when we were there. So then we can have, I mean, like, it is ensure we are doing the right thing. And when if we refer for those people, I mean, we start refer those children to you, at least we know it's done correct. My concern of doing visual acuity before we get there, that means we have to ensure that they have a proper training and they're following what they're supposed to do. And that might be a challenge for us. And that's why I said, for your team, it's going to have more people, definitely, because we need to do the acuity. And there's people who are helping on your section. Also, they're going to be helping with the physical assessment, you know, like just getting data to identify which kid goes where, and screening where they are trying to get the basic vital data for Dr. Msambichaka and Dr. Fabian, and also for you. They will include the visual screening, because the visual screening is going to be done for every single child there.
Okay, I got you.
Yes. But yeah, we're gonna do. I mean, remember we said we're gonna do the training before we get there. So you at least give her the instruction that the people who are going get a little trial to make sure we know what we are doing, and then when we get there, then we can do the accurately the first time.
Okay. Okay, yeah. I got it. Now, will the pediatrician, myself, will we be staying at the school for the full 8 days?
No, not all the days. So that's why I said for you, definitely at least 5 days, and then the other days it depends. And we're going to take you to the clinic, what they call clinic, vision clinic. So then you can go. If we identify that first week, all those children that need help, because they have to be referred to the hospital or clinic, somebody needs to go and do more interventions or something that they need to be more closely monitored. Then yes, probably the second week you go with other those kids on the other side of the hospital. Okay. Yeah. Okay. Yeah. And that's why we want you to start with the acute, I mean, the children who are already at risk. I mean, they've already been identified. So if you start with them, and then now after that, you'll be waiting for one of the children who are being identified by the vision, I mean, the visual acuity. And then, so that's the ones you're going to look at them within 5 days, because you're not going to see all the eye exam for 800 kids. You can't be there. You're not going to be able to do that. Right. Yeah. Okay. Thank you. You're welcome.
It's Lillian. So from a vision acuity standpoint, I thought there were already some that were identified. I think you said like 35.
Yes.
So those were identified just based on, like, they just are not performing well in class, or they are not seeing.
According
how do you know, how were they identified? Do we know?
From the teachers. So they see, I think, the children who cannot read, or they are struggling to read, or they identify them from their parents, tell them, because I don't think there's any physician screening was done and then the child got a diagnosis. I don't believe so. As far as I know, is from the teachers identifying, okay, this child is struggling to read, maybe they need to do this, or this child is complaining of their eyes all the time. So they identify those kids that way versus having like an actual diagnosis from the physician.
Okay. So the only other question, sorry, go ahead.
No, go ahead.
Oh, no, I was just, let me turn on this. Sorry, oopsie. Did I just, okay, sorry. No, the only other question I had is for, like, for us, how much time do you expect us to spend at the school? Because I'm thinking with, 2-3 different sites with the medical component of things. I'm not sure how much time then we will have to actually, assess some of the kids, or at least, spend time with them, the high risk ones, on both spectrums, very low BMI or high BMI. Because I'm assuming we won't be there every single day, like Dr. Vanessa will be since she'll be doing like, more like, she would need to be with the students to do the vision screening. That will be at the hospital. And then at some point, we'll probably have to be at the school.
Yes, so as of now, I was saying because we have 4 locations, and then so I'm assuming you and Dr. Fabian, because you're needed everywhere, you have to go there at least each location you do 2 days, full 2 days. So when you're doing 2 full days, then chances, let's say, I'm just giving an example until we work out the schedule. Let's say you're doing neonatal, help baby breathe.
Helping babies breathe.
I know, I keep saying help a baby breathe, and then maybe the next hour you do hypoglycemic training, training protocol. And then maybe in the afternoon you do a newborn assessment, or maybe in the evening you do something as newborn related. So all those things, those 2 days will be fully loaded with that part. But remember, that will be almost like at the end of the term, because before that, 2 or 3 times or 4 times, depends on how many months we're going to prepare, like April, May, June, July. We already start teaching them. So when we're going there, it's going to be a demonstration. So you expect them to do return demonstration, kind of evaluating them on that time. So then you can identify what is missing, what is so hard, to understand. Let me demonstrate in front of you. Let's say maybe do an actual assessment of a newborn and then see, this is how we do the assessment, and assess them if they've gotten it. But by then you've already spoken to them about newborn assessment. What are the area landmarks you have to look for it? And they will ever identify this child who is sick for hypoglycemic. What are the clinical findings? All those things, we have spoken with them already before we get there. So when we get there, it's going to be probably more finalized evaluation, demonstration, like almost because we have only 2 days on that location.
Okay.
Yeah. That's why if we can get like 5 pediatricians, that would be great.
I know, right?
Yeah. So then we can say, okay, you stay here, all your 10 days. See all the babies.
That would be lovely. I wouldn't mind.
I know. We need to get some more though. We need to get some more.
Working on it.
Yes, thank you. Any other questions?
I have a question.
Yes.
So do you think Dr. Rima could provide a list of subject matters he want to hone in on for burns, instead of me being all over the place and not knowing where to start?
Yes, so that is one of the things we are going to, because of the time limited of things that we can focus on, and some of the education that we're going to do before we get there. So yeah, we're going to probably ask them to give us 3 priority things. And then they're going to identify. So for Mwananyamala and Buguruni and Muhimbi, they already identify those areas. That's why we put in groups, like for obstetric area, maternity area, those are 3 things. Newborn, what I was talking to Dr. Sambichaka there, was like 3 areas. And then so they know already that those are the areas that they need the most knowledge and training. And then so we can do the same thing with Dr. Mrema and just identify. So you can focus on those 3 areas, starting from right here, like give more discussion, give more time, give a little lecture and see an hour of it, something like that. So then they prepare before we get there. And then when you get there, they'll be like asking questions, just getting to be like putting all things together. You have an advantage, Ms. Victoria, you have an advantage because you can have all those 5 days, day in, day out, you have one area to focus on. Unless maybe we find at school, we start seeing kids who are experiencing burn, or they have contractures or something that we need to, they need support. Then maybe the second week, you can come to the school and see and give more, like your suggestion or something that the teacher needs to watch for, or let their parents, those kids know. And so that's why we can work that way, at least to help. But at least I suspect that you're gonna have the whole 5 days in that area. So you have focus. Yes, you can focus and pray around with your babies and help them, yes.
Some more of
so one of the 1 or 2 days, Ms. Teresa is gonna come to also to our unit. So the same thing that we're gonna ask Dr. Mrema, if there's specific things that he wants addressing on the nutrition, so then we can ask Ms. Teresa, and then Ms. Teresa can come and teach the nurses and the doctors on that area, or those, whatever the combination they have or what they need to be able to support those kids, the patients, and then if they need specific training. But we know that before we get there.
Okay, so I am more of a hands-on teacher
Yes,
or hands-on trainer.
yes. So you're gonna do a lot of demonstration, exactly.
Mhm.
And then ask them for return demonstration. So what I'm saying, like, if to teach before we get there, is like, I mean, have them a discussion. Instead maybe of have a lecture style, then have a discussion. Ask them what are the struggle they have. I mean,
Okay.
healing time, longer than that, what you guys are doing. Because you have that experience, you can just bring them to bring those ideas and then put it in you know, like a summary, create something, and then while you're explaining to them, put it in on the YouTube, because we're gonna ask them to use the YouTube a lot as a resource, even before we get there. So all this training that we're gonna prepare, we're gonna put it online already before we get there. So they have the resource to review before we get there, and then we can finish up teaching.
Okay. Thank you.
Yeah.
I got something. It's not a question though.
Yes.
I was just going to state, I know everybody should have gotten or received an invitation to our project management application called ClickUp. So that is for board members and team members, so that we can actually monitor and manage all of these different aspects or these different programs. So you saw a spreadsheet that kind of gives you an idea of what you're doing. But if you go into ClickUp, as we start to develop it, you're going to see everything. You'll be assigned a certain task. If you're interested in participating in something else, then you just have to tell us. And I just want to state too that if you look at what's going on here, it's really a collaborative effort. So I'm going to be helping out across teams. If I can help, if there's something I can do for the people who are at the hospital, if I got to jump in the car or do something or go there, or even media coverage, whatever, different things like that, or bringing supplies, whatever. So some of us are going to be a little more flexible. We're going to be dealing across teams and stuff like that. So we got to remember, this is a collaborative effort. Same thing with fundraising. So fundraising is a big component. We have to really get started on that. The executive team has already discussed that. So we're going to be looking. So we'll use ClickUp. We're going to use whatever we can. We're going to look to see if there's a team that's not actually meeting their goals. If a team meets their goals, then we're going to go, if one or two of us, maybe whoever's available from another team who might be able to help them, we're going to go and try to help them. But we're going to manage this as teams this time around. So instead of everybody just fundraising for one general pot of, which is not as efficient anyway, but we're going to have teams and they're going to do fundraising, but we're not going to let other teams fail. We're going to try to do the best that we can to help all of them. And eventually I'm going to meet up with, let's say, Vanessa, definitely with Victoria. I know we started the nutrition. That was kind of like a template inside of ClickUp, but we're going to develop all of your tasks, a list of taskings and documents and all of that stuff. And all of that's going to be generated within the ClickUp app. So ClickUp is really a project management application, and it's free. So then we can go in there and we can look at statistics. We have graphs. We can see, well, this team is not meeting their deadlines. This team is, or maybe they're behind. And it makes it really easy for you, because all you have to do, if you have a document or if you have a letter or if you have something that you want to post in there, you just go ahead and put it in there. All of your team members can see it. We already put, and it's just to show you how, when I say like collaborative teamwork, Dr. Msambi Chaka sent out an email for possible funding or grants and stuff like that. So that's what I posted in the ClickUp, but that is for nutrition. Both of the grants that she sent it out are for nutrition. So she's not necessarily specializing, let's say, in nutrition. She's a pediatrician, but it's collaborative and it's interdisciplinary. So that's what we have here. We have kind of like a collaborative and interdisciplinary team. So we're going to be divided up according to certain groups, but we're still going to be there to try and help each other when needed. So, and then thanks, Dr. Msambi Chaka, for sending those recommendations. And if you notice, she also has expressed, Dr. Msambi Chaka has expressed an interest as well in the vision aspect of the mission So, I mean, it's like I said, it's interdisciplinary, and we help, everybody helps, is going to help everybody else, but we are going to be specialized or kind of like structured according to teams. And all of that's going to be managed through ClickUp, because we're becoming more of a formal organization with kind of like a business profile, whether it be for profit or not for profit. It is non for profit, but I'm just saying it's a business profile. So we're going to need everybody to start going in there and then managing their projects and their taskings or their lists and stuff like that. And it's going to be the members who are going to generate. I'm going to work with you. We're going to generate those lists and those taskings so that we'll be able to monitor them. And we're going to assign team members as well to each of those different teams. So that's basically it.
So, Parant, my question was, I went into ClickUp today. I don't see anything. I don't know how to navigate this particularly, but can you kind of point me in the right direction? Show me where I'm going?
Sure, I can. I don't know. It's up to Dr. Gaboni right now because she's doing this meeting, and we decided that it wasn't for ClickUp. But at some point I could do it with you individually, or if we have time today, I can show whoever's here in the meeting as well. And remember, I'm learning this as well. And believe it or not, I hate to kind of like digress, but this whole concept of the project design manager, I got it from my daughter. So it's the young leading the old. How's that sound?
Yeah,
And here I was feeling bad because I'd never heard of ClickUp.
Okay,
I
so,
hadn't either, Victoria.
huh?
I hadn't heard of it either.
Okay, so thinking of those schedules that I was showing for different locations, the same thing. Then if we upload in the program manager, it's gonna show like, okay, this group is doing this group is doing that. How are they moving? Things are moving. Schedule is gonna be shared that way, and then so it will reach a point. Yes, we are doing the fundraising. We're gonna itemize those things. Okay, the nutrition group is raising that much. Whatever school is raising that much. NICU is raising that much for Buguruni or something like that. So all those things are going to be itemized. And as I said, I think on the nutrition group that because this is a non-profit organization, if the money is raised for specific goal, that's where it's going to go. So let's say, for example, nutrition get $100,000. Yay. We cannot use it anywhere else, only nutrition, because for tax purposes, people will come after us. So we are going to like itemize things, but we're going to watch what like Mr. Prank there was saying. We're going to watch which group is doing what. We're going to try the best we can for individual groups, but also we are raising money for the whole medical mission. So if it's needed, then we can, allocate the funds that needed for those areas, and then it'll be covered, because it's the whole mission. It's not just one group is going to do by themselves, or we can let one group with sync. No, we can't do that. That is the whole mission. We have to work together. And then so we just identify, sometimes it's easier. For example, let's say I'm working with the school and I'm raising backpack. Okay, I can work with backpack. Okay, and beg for everybody else who can help me buy 800 backpacks. So it's easier for me to say I'm raising money for backpack instead of saying, okay, I'm raising money for backpack, neonatal resuscitation, pads for postpartum hemorrhage. If I say too many things, people will be like, you know what, that's too much for you. So it's easier, so we put people in groups, so it's easier for individuals to go and say, ask things specifically for one thing. And it's easier for people to support that way versus listing 15 things that you're raising funds for. And people will be like, okay, they're confused, that's too many things. Or they might think, okay, maybe you just need $500 for that. But if you ask individual, you might end up with $5,000. So we're gonna try and do as much as you can. Somebody's raised their hand.
Yeah, that was me, sorry. I just wanted to add that we're trying to also give everybody a more professional profile, because remember, this is a meeting for board members, and we've invited some other people as well. So we're going to make sure that you have the organization email, letterhead. So when you go, hopefully I'm going to get some business cards. I don't have. Harriet has some really nice business cards. I don't have any yet. But, business cards, things of that nature. So when you're out there presenting and pitching for QHSC, everything is going to look very professional. So it's a change. We're evolving. So just remember that maybe what you saw last year That's the past. So I can't say that in Swahili. I don't know a saying. Maybe George can help me. But what was in the past is the past. Today is today. So we're looking forward to bigger and better things. So
I guess my biggest concern today though was, and you kind of hit on that before with each group being just for that group, but the purpose was if we have, say we have 15 things that we're looking for and we don't get enough for all 15, then does it get concentrated down to fulfilling 8 things? Or do we just not have enough for 15? You know what I'm saying? I just, either we go all out and get all 15 covered all at once, or we scale back a little, choose the 8 most important and make sure we get those 8 things covered. That's the only thing I'm afraid of, is that we're gonna come up short on.
No, we're not coming up short. We're gonna put all our effort and we're gonna go hard and we're gonna raise money like in ever before. So we are going to address, and we're gonna be evaluating as we go. So every month we're gonna figure it out where we are and what are the things that we need to focus on, how much attention needs to be added to certain areas, because all these areas we already identified that they're needed. And then so if we select those areas because we knew we can do it, and that's why we're doing things a little bit different. We used to like prepare ourselves and then go do all the education in one time when we are there. So right now we're not doing that, but we're gonna start education now. By the time we get there, even if we have 2 days, for example, let's say for Dr. Msambichaka and Dr. Fabian, for the neonatal and pediatric area, for let's say for Muhimbili, instead of them spending 8 days in Muhimbili, they spend 2 days. However, they've already taught the same people for the last 3 or 4 times. So that's how we are stretching ourselves to be able to cover a bigger part and have bigger impact versus just focusing on doing only a few things when we get there. So I do share your concern that yes, maybe we might extend ourselves. We might extend ourselves too much. But remember, we started with 1 person for 2 years, then we came to 5, and then we came to 20. So my math really is like 1, 5, 20. It needs to be 50. In my head. Don't ask me how I get to 50, but we're gonna get there to 50. So we're gonna recruit so many people this time until we get to that number, and we're gonna go and do those things. And I believe the more we extend ourselves and expose ourselves out there by using our business presentation, then we're gonna get better response than if I'm the only one person singing about QHSC and they're gonna thinking, okay, what is wrong with her every time QHSC, only 1 person. But if we have 50 people are singing QHSC, I believe even if each one of those 50 people get only 10 people, we are in good shape. So I believe we can do it.
All right. One more question?
No, that's fine. You're allowed to be questioned, yes.
I'm really, really hooked on this nutrition thing and feeding these kids, because I mean, my big thing is I can teach kids for a year with no pencils and no paper and no, if I have to, but I cannot teach kids who have no food. Nobody can. And the fact that they're passing out, and it just, it really bothers me. So do we have someone in line already who's looking into, I know Teresa said she was going to look into growers and suppliers there for food. Do we have someone who's looking into like catering, or, you know, how do we get that started and get that rolling? So
there is so many moving parts behind the scene dealing with the nutrition. I agree with you. That was not the main reason for this mission. But talking to Miss Clara, the teacher from that school, and I had the same story. I was in tears because I said, I wake up in the morning, just open my fridge, the food is right there. I don't have to think twice. This child wake up at 6 in the morning, arrive at school with no food in the stomach, and they pass out in the middle of the day because they want to come to learn. They didn't quit to go to school. They went to school to try and learn. So nutrition becomes a central part. However, it's not going to take over the whole mission, because we still have an obligation to do training and educating and health promotion, disease prevention for these kids. So we are still going to do all those things that we need to do. still we're going to focus also on the nutrition if we can address it. As I said, it happens in the NICU, it happened in burn area, it's happening in mid-stage area, it's happening in the pregnant patient area. Nutrition is everywhere. It's singing the same song. So we are working on different avenue to apply for grants to try and get them, because it's a huge price tag. And it doesn't make any sense to me, at least, feeding these kids for 1 week and then say, oh yeah, we did. No, it's not. So if we're going big. If we can get them to feed them at least that porridge for a whole year, that's the aim we have. We come short, we're coming to that 6 months. So we're working behind the scene. Yes, Ms. Teresa is working, and thank God she's working behind to try and get us some funds. But yes, we still have to do those funds. And I know Ms. Valentine and Ms. Christine are working also behind the scene to try and find different funds from different areas to be able to support the medical mission from a different standpoint. But yes, we are trying to get more money to try and address the nutrition. But yes, so it's not either or, and it's not one above the other. No, we address them with different challenges, and so we're going to try to raise money the same way. But we know nutrition is a huge thing. So $50,000 to start with is not cheap. Also for people to cook, to get maybe catering to bring the food in there. That is a challenge right now, as of I spoke to Ms. Clara, because we have to have so many permission, and there's a licensure, health restriction, screening, whatever is going on. So bringing somebody else to cook outside and bring the food at school also, it's, I mean, like you have to pass through certain things. So as of now, they would rather have people cooking at school. And then so part of the thing that I went back to her and I said, if the school is going to take responsibility of cooking the food, they have to reassure that the people who are cooking are, I mean, equipped and clean and all the safety stuff, because in that building that we're going to, when we get the money, when we get the money, how is it going to be clean? I mean, like, because we are not going to save the food on the place that I can't even throw my garbage there. No. So we have to make sure that area is clean enough. And then if they want to cook, then how are they going to reassure that these people are doing very well in that area? So there's a lot of discussion is going on. So many things are going back and forth. We want to make sure, because of course we have to get the health permission to save food in the school vulnerable population. So there's a lot of stuff. Hold on a second. Somebody's raising a hand. Is it Dr. Msambichaka?
Yes.
Yes, that's me.
Okay, go ahead.
But you can keep talking. I had raised my hand and you answered most of the questions that I had. But yeah, I'm with Miss Kristen on this. You know, I think nutrition is kind of like basic. It's a basic need that pretty much covers everything that we're doing right now. And obviously, the price tag is also daunting. And so I think if I understood her point was like, you know, if we raise money for backpacks and all the other stuff, but then we come short on nutrition, do we, you know, pull the money together and put it in one bucket to fulfill this one mission versus, you know, not? But I guess you kind of briefly answered that a little bit, that we, you know, you think big and start small, I guess, which is a good thing. The other question I think that I had was also, you kind of answered that, but I was getting nervous that we, you know, the people on the ground, like we had not heard any feedback in terms of, you know, do we have somebody that can make meals? Do we have places where if Ms. Teresa comes up with the recipe that we can actually get the, you know, the basic ingredients from? Do we have somebody that can actually mix this, recipe for us? And then obviously the next step is who's going to prepare the meals. But it looks like there's something going on already in the background. But yeah, that was my concern. Like, you know, we could raise all this money, but if the groundwork is not, you know, done, then we would still, you know, fail at executing and implementing it.
Manga, did you raise your hand?
Yeah, I was going to say that the nutrition also, we have to remember too that it is important, and it's not just in the schools. where they are saying that they're having an issue with it. So it's definitely going to be something that's going to be used in some of these other locations as well. So, I mean, there's a lot of things to do, a lot of things to look at, but I don't know if preparing for a mission where you have all of this specialized help, and spending all this time preparing for that mission, and then just shifting gears to one specific project. I don't know if that's the best way to manage people's time either. So that's something else that we have to consider.
So I want to go back to Dr. Sambechaka, your second part of the question. You were talking about having somebody in Tanzania who can, once Ms. Teresa comes up with that cocktail, we can get resource or whatever, the flour, the recipe, or whatever. So there are some people who we could use, but also, of course, they will be through vetting and make sure they sign contracts and all this stuff, because there's so many things that we want to make sure if somebody is preparing something, is it going to be consistently the quality that we want? I don't want to be this rush that just because it's for the kids, they will never know. No, I don't want to do that. So yes, there's so many people, probably 2 or 3 people behind the scene that we have already identified, but we've not given them like the green light or something like that, because we have to vet them a little bit more. And also that's one side. So then when you go to the school, the head teacher with the Ms. Clara, then they have their own challenges in the sense that the district may not allow us to bring the food to school. So then other things that we have to address, they can be sure that they maybe give somebody, either be hired through school, take responsibility for themselves, and then offer that food. So are we bringing resources for them to cook, or are we getting somebody to cook from outside? As I said, somebody cook from outside, they don't want that. They want somebody from there. So I ask them, do you have actual cook for school that you hired to cook the food for students? No, they don't. So then I said, then just in case, so if we select, we get the money to buy the food and give you resources, those people, I mean, the school can ensure that the safety and the cleanliness and the quality of the food that the kids are getting is going to be for what we expect. So that's the part that she said. Those are the things that they're still talking about with the head teacher right now, because I said we are not going to save the food if the environment is not conducive for healthy breakfast. So there's a lot of things going on behind the scene. Yes, we don't have the money yet. I'm waiting to receive. But once we get it, then we're going to definitely be able to iron out the things. So if we started getting maybe some response from people who we are asking now, and then there's an indication that we are getting, then yes, the part from Tanzania is going to be brushed out quickly. And then to be able to say, okay, what can we do, and what how we facilitating this part to happen. But yeah, so nutrition is still, it's continue being discussed, and there's a lot of things that we have to abide by, you know, like a health related to bringing food to the children, especially children. I think if we saw that, they would probably care less. However, if you're going to feed the children in school, they want to make sure wherever you are feeding the children is appropriate and approved. And so yes, we can find resources from back home, and making sure those people who are already doing the business right now have permission to do business already. It's not like a brand new person to go and they have to go and ask for permission to prepare food for public. So if somebody's already have their own business right now doing it, so then we have to work with them to make sure, are they allowed to come and prepare food for these children at this district? And then, so do we have all this permission? Yes. Now here's the money. How are we going to manage it to distribute weekly, monthly, and a year? So yeah, there's a lot of things going on.
How did you find the caterer from last year?
I'm sorry, do what?
When we provided lunch to the school, how did you find that caterer when they came in the trucks?
Oh, the one from Congo?
Yeah, Congo.
Yeah, so usually they bring the food when they come to different services to school, they bring the food already. So it was easier just to make those arrangements quickly, because that person is already approved and they know the quality that, yes. So that's why we are trying to find somebody who is already kind of doing that part, but who can deliver the quality of the porridge that we want, yes. Yeah, we're not going to just ask anybody. That's why it was so hard to say, oh, we can have, let's say, I'm just giving an example. Oh, I can have my sister cook for the student. No, it doesn't work that way, because you're feeding these children. You have to pass it through a lot of things to be able to get, which I agree, because feeding a child, we do not want anything happen other than nourish them and get them healthy. Yeah. But yeah,
Yeah.
if we can do it, that would be great. Yes.
Yeah, I mean, this is George. I want to add a little bit there. So I would say, as we are plan and do the preparations and prepare for the mission, we also need to also collect more information from Tanzania and collect information about the school, information about the logistics. So because as time comes and we get closer to the mission, we need to set priorities and actually do see what we can do and see what we cannot do. I think the plan should be everything that you are trying to do should be sustainable. We don't want to do one thing, 1 week thing or 1 month thing. We want to do something which will be sustainable.
Exactly, excellent point. That's why I said, I'm like, when we are trying to talk to them, that's if the school is gonna hire people specifically for that task, I want the quality, I want the safety, I want the healthy food all the time, and it has to be for a whole year. So how do we keep that? And because we do have, I think last time Ms. Clara mentioned that they do have a teacher on duty, I think TOD they call them, teacher on duty, who will be able to monitor like how the children are receiving, all the children receiving the breakfast, and then how do you make sure that, you know, like that person is going to test to make sure that porridge that day is acceptable. And then so they have that person right now is like on duty just looking like checking the cleanliness of their own school, so then they can keep an eye on the preparation and how the service, the serving of the breakfast is. So those are the things that we're still discussing, and of course we're going to have more meetings as we see this thing becoming fruitful. And if we receive a first check, we're going to speed up things. I'm like, come on, we got this, we need to be able to do that. So I repeat again, if you have anybody who has the money underneath the bed, they hide it, they don't have anything to do with it, please, let's get those people help us so we can help these kids and feed them at least a year. That would be nice. Yes.
Can I another question?
Go ahead.
That was my other, when you said you posted the proposal letter, you're frozen. Oh, okay. Can you hear? But Parang, can you hear me?
Yes,
No,
I
you
can.
are frozen.
Okay.
I can't see anybody when they're frozen.
My question was, you said you posted the proposal letter.
Yes, I did.
And that is what I couldn't find. But I have a couple companies that I've talked to people that might be able to contribute a large sum if I can, if I can meet with them. And I kind of want to look at that letter first, and I've been getting some different ideas about how to, really put together a compelling.
No, which I mean, I appreciate that, Ms. Kristen. That's what we want. We want to make sure, for example, if you have somebody who, and that's why we put things in groups, because there are some people who are dedicated to help with nutrition or feeding the children or feeding, ending hunger or whatever. That person is not going to hear you when you say, oh, I'm asking for backpack. And they'll be like, you know what, leave me alone. But that's why we said we want people, if you can get somebody so you can ask specific for feed the children, and we tell them 800 kids, and every kid, I believe, Dr. Msambichak, I'm gonna steal your line. You said you can feed the child per day $1.20. So if we put those things in numbers for somebody who knows, okay, $1.20 per child per day in 800 kids, for a year is 48,000 and whatever dollars. So if that person can say, you know what, I have $50,000, I just feed those kids, we will sing their praise. So just let them know. Yes, I mean, if are those letters, Paranka, that are they visible for everybody else or people who are doing grants writing, I mean supported writing? You are muted.
Yeah, right now there's only a few people assigned to it, but if possible, I could pull it up on the screen and then show everybody really quickly how it works and everything like that and what we have in there, and then show Ms. Kristen how we would then build separate lists for the different donors that she would be applying to and the amount of money, let's say, that she's expecting to raise and stuff like that. So,
but she has a different people, not on those grant people.
exactly.
Right.
So it would just be something else that would be added to the list or the tasks. Well, I'll show you. Let me show you real quick here. Hold on.
Okay.
So can everybody see my screen?
Yeah.
Yeah.
So if you notice on the, like towards the top left where I'm highlighting, it says Dr. Gaboni, QHSC Global Operations. And then if you look down towards the center on the left, you see it again there. This is a workspace. So we're only going to have one workspace. Believe it or not, I'm learning this stuff as I go along as well. Then if you go down to the bottom, you'll see like there's my avatar or whatever picture for myself. And then there's one for the same project design manager workspace. So that's what you're looking at here. Dr. Gaboni, Global Operations. So if I click on that, that's where we are right now. So if I want to go to, let's say, fundraising, which we're discussing now, you see all the different folders there. So Victoria is going to be, or she has access to burn and wound. So if I click on that, it comes up, but we haven't done her. I only set one task for her, and that's the needs assessment, which she's working on right now. And if you see over here, it says VJ, that's Victoria Jones. And as we go along, if there are members that can be added, if I'm not sure if we're going to be adding some of the folks from Tanzania or not, if they're able to join, but so that's her workspace. So I'm going to call Victoria. We'll have a meeting and we're going to start to outline all of her tasks and all of those things like that, and we'll assemble her team in there. If you go to fundraising, go in there now. If you go to fundraising, so we have a list actually in fundraising. Here it is right here. Okay, so if you go to fundraising, we do have a list in there, and it's called the D Prize Custom Challenge. That's what Dr. Msambichaka sent us. So this is actually just kind of like a summary of what this project is for. This is for nutrition. This one is for nutrition, and it's a $20,000 grant. And what I'm hoping is that myself, Ms. Teresa, Dr. Gaboni, so we can actually go in there and collaboratively work on developing this proposal. And the dates are set already. I can't see them because the Zoom images are in the way, but if you see there's a due by date, if you see your assignees, you have Dr. Gaboni, and you have Teresa Cooper, you have Catherine Dudek, you have Valentine Dante. I thought I had added someone else there, but maybe I didn't. I'm having trouble adding more people. I think that's what the problem is. But we'll have different people who can be added to this group, and we'll work on developing this document. I'm actually going to see if I can write a paragraph or two myself. And then if we can, we'll crank out this document and get it out. And it should be, if you see the due date, that means that this application or this request for a grant is due maybe a week, probably about 2 weeks after that date. So we have that much time to actually draft, and you'll see the proposal and the submission dates. All of these are the tasks that we have here. So, and I'm still trying to figure this out, but that's how it's going to work. So I'll get together with Vanessa. I'm not sure if she's still on here because I can't even see it. And then we'll develop a tasking list for her as well. And then if you look, we see that Kristen is assigned now to to something. So she might be in there working. So this is so that Dr. G and executives or even board members can actually monitor what the organization is doing. So if you go to, let's say, let me see, I'll go here real quick. Let's go home. Let me see where this is here. So this is my settings in my area here. But if I want to I'll go to spaces. So this is the spaces here again. Let's go to that. Let me go to that space there. So this is Dr. Gavoni, Global Operations. So we want to get a view of what's going on. I'll try to get an idea of what's going on. Then we could come here, and there's different views that that members can use. So we can go to, let's go to the Gantt. We'll go to the timeline view. You're not going to see much because a lot of the projects are actually out in advance. But if you come here and you start to scroll over, you may start seeing some of the events and the deadlines. It's even here for some reason. But if we go to board view, then we can see all of the things that are going on. Oh, because let me see here. So it does take a little bit of learning. So here, so when you go to the main global operations tab, then it's going to show you everything that's going on. We have orientation of team members. We have branding and media, which my son Prank is going to be helping with and stuff like that. So, but I'll leave it at this for now because we're running short on time. So, but so I'm going to get together with each of the different groups, and we're going to set up their works. I'm sorry, we're going to set up their folders with their lists and their tasks.
Okay, thank you.
All right.
Any questions? Oh, Dr. Samchak, yeah, $1.20 feed one child for 1 week. Oh my God, in fact, I thought 1 day. So $1.20, that is a catchy phrase to use. If you can feed a child for breakfast using just $1.20 for a week, I mean, you can feed 5 of them with Starbucks. Thank you, Dr. Msambichaka. That is a nice one. I'm going to use that in my commercials.
I was going to say, I think that might be accurate because I think I saw something in one of, because she sent also, she sent another one for the World Food Program as well for $100,000. I'm not sure of the deadlines and dates on that one, but somewhere in there I read that they said it was, I think it was 18 cents a day or something like that. So
yeah, because if you take it, yeah, we take $1.20 divided by 5, yeah.
Somewhere around there. So that's even better news. So maybe our target, we have to really look into that. Maybe our target can be a little lower, and maybe we can reach that goal a little easier. That might, I mean, that's my assessment of that statement there.
I like the 100,000 though.
Oh, me too. Especially when we're moving towards sustainability, right?
Yes, no, definitely. So, I mean, I think, yeah, we're thinking big, we're thinking outside the box, and we need to get more aggressive now. So the schedule, as I said, we're going to continue playing around with it, and then we're going to share it, and then so people will see it. But just remember, if you are doing something that is expected to be done in multiple locations, then you are going to spend probably 2 days here, 2 days here, at least 2 days. And then we figure out in the schedules. And then, of course, we're going to ask our host administrators, I mean, like, as you see in the schedule, to tell us what specific are that. If they have to choose only 3 things that we need to do, what are they going to be? So then if that hospital maybe wants more health, maybe breathe versus, I'm just giving an example, versus neonatal research, newborn assessment, then we can say, okay, Dr. Samtara is going to send it 2 days here, but 3 days on this school hospital that needs, or 3 days in on school where we need to do physical assessment for all these 800 kids. So there's a lot of stuff like that. And we do need to recruit the nurse practitioners who are going to probably help us with all those physical assessment also. And then if we get more of them physical assessment for the school, then we can leave Dr. Msambichaka and Dr. Fabian to focus on the acute area where they can have to deal with that part. So it's a lot of stuff that we are working behind the scene to try and get more people. As I said, we need to do way, almost more than double the people who went last medical mission. So yeah, there's a lot to be done, but I appreciate you guys even just giving us that time to come and hear what is going on and share your suggestions, because definitely we need all the brains we can get to be able to figure out these things and make it more efficient, because the more organized we are, the more impactful we're going to be. And we want to leave there, be satisfied that we did address what we went to do.
recite an ancient Swahili proverb, which Victoria just sent to me. So it's got to be ancient, right? Yaliyokuwa zamani ni ya zamani na leo ni leo.
Yes. In fact, the other way I would say, leo ni leo, msema kesho. Muongo. So you have to do whatever we need to do for today. You don't have to like plan backward or think of too far ahead, but just focus on today. But yeah, so that's very good. Where did you get that? Thank you, Miss Victoria. Thank you. Any questions, guys? I know, as I said, we don't want to take too much of your time, but thank you very much. Any questions?
Have a good evening, everyone. Thank
you
you.
very much, Victoria. I'm going to talk to you later. Yeah. Oh, Sunday. I'll talk to you on Sunday.
Okay. No problem. Take care, everyone.
Thank you. Thank you very much.
Yeah, yeah. So it'll be great to get together and finally be able to talk to everyone and meet everyone.
No, that would be great. I think we need to figure out somehow for this summertime.
Yeah, yeah, that would be awesome.
That would be great.
Yes. So everyone have a great evening and thank you.
No, thank you for coming, Dr. Vanessa. Yeah, I will talk to you on Sunday. Yeah.
Okay, very well.
Take it easy.
Okay,
Bye bye.
Bye bye.